All right, so you've been scheduled for implant surgery. Now, of course, there's lots of questions. One question is are you sure, Dr. Greenstein, this is what I need? Well, if you've gone through the motions of medications like Viagra, Cialis, and Stendra, if you've tried injection therapy and it's just not working, or it's too costly, or it hurts, well then this is it. It's time to move on. It's time to have the implant and get your sexual life back in order. So after you've come into the holding area in the surgery center or hospital, after you've gotten your IVs, we're going to give you a lot of intravenous antibiotics. We're then going to bring you back to the operating room. You're going to get general anesthesia, and then we start the process of putting the implant. And the process begins with actually first cleaning the skin a lot to make sure that there is no bacteria, no fungus living on the skin, because we all have bacteria and fungus living on our skin. This process actually takes anywhere from 10 to 20 minutes. While I do this process, I also put a lot of numbing medicine into what's called the pudendal nerve. This is the nerve that feeds your bicycle seat area of the body. Once this is all set and all the area is prepped up and the drapes are on, that's when we start the surgery itself. And that's where we make a small incision about 1.5 inches just above the penis. We then find the cylinders inside the penis called the corpora, and we start putting the implant inside. After the surgery is done, you'll wake up, you'll have your drain, you'll go to the recovery room. I would say 99% of my implant surgeries are done as an outpatient, either in our surgical center or at the hospital. So in other words, you come in, there's always paperwork in the holding area, got to sign a lot of things, unfortunately. Then you get your IV, then you have your surgery. The surgery is anywhere between 45 minutes and about 1 hour and 15 minutes. And then you go back to the holding area and you're there for about 1 hour or 2. Then you go home and you just get better. Now for the 1%, those are some patients that are a little bit sicker. They have some heart disease, patients who are on dialysis and I need to monitor them closely. Those men I'll keep overnight in the hospital. So there's a lot of behind the scenes work that will get you to your surgery. The behind the scenes work of course is going to be insurance information. We're going to need clearance from either your medical doctor, your cardiologist, or even sometimes another specialist like a nephrologist or a pulmonologist. We're going to get blood work on you a week beforehand. We're going to do a urine culture on you a week beforehand. And we're also going to do any screening to see how sugar levels are doing for my diabetic patients as well. So you're going to be having general anesthesia for your implant surgery, which means you cannot drive home after your surgery. You shouldn't even be driving for a couple of days after your surgery. So you're going to need a friend or family member to bring you to the surgery center or hospital. You can't use Lyft or Uber, okay? So you need someone that you actually know. So thinking about weeks or even months before your implant surgery, there's a number of things that we may have you do to get you ready for surgery. For our diabetic patients, we want your sugars meticulously perfect. We want a morning sugar in the hundreds. We want your hemoglobin A1C as low as possible. For many men, we'll also have them start using a vacuum device. And this is more of therapy, not to use it for intercourse, but the idea is that if you use a vacuum device that's going to pull the blood into the penis, there's some data that shows that it can actually make the penis longer and wider. So when we do your implant surgery, we can gain you a little extra 1/4 inch or even 1/2 inch. When it comes to preoperative medications, the big group of medications that are important to watch are the blood thinners. So this includes aspirin, Plavix, Coumadin, Eliquis, Brilinta, etc., etc. And usually we will coordinate with your medical doctor or your cardiologist to make sure that we stop these medications ahead of time. As far as the regular general medicines that you use, like your heart medicine, your blood pressure medicine, we want you to keep taking those on a usual basis, and we are going to want you to take those medicines with a small sip of water before you come to surgery. When you go to bed the night before your surgery, we're going to make you what we call NPO. This means nothing by mouth. So in other words, when you wake up the next morning, do not eat or drink anything. Please do not come into the surgery center with a cup of coffee. You will be canceled. You're allowed to brush your teeth. You're allowed to take your medicine with a small sip of water, nothing else. Don't do it with milk, don't do it with OJ, just water. If you come in with something in your hand, or you tell my staff that you had coffee, a small piece of a granola bar, whatever it is, you're gonna get canceled. On the day of surgery, you should bring two main things with you. One is gonna be a loose-fitting pair of sweatpants, all right, because you're gonna be a little puffy down there. You don't want anything constricting your waistband. And then I would also recommend bringing boxer briefs, something that's snug, something that's gonna hold in an ice pack and some of the gauze that we use after the surgery. So as I mentioned in one of my earlier videos, the biggest side effect is an infection. And the actual risk for infection actually comes from the skin. And so we don't want you to do anything to your skin prior to your surgery. Don't shave, don't do anything. We will take care of all that here once you get your anesthesia. Okay, so it's time for your implant surgery. Today's the day. So what are you gonna do? You're gonna wake up. Remember, nothing to eat or drink after midnight. You can brush your teeth with a little bit of water. You can take your medicine with a little bit of water, and then you're coming on into the surgery center. Of course, there's paperwork. There's lots of things to sign. You're gonna get put into a gown, and then an IV will be placed in your hand or in your arm, and antibiotics and IV fluids will be given. You'll then be brought back to the operating room. You're gonna lay back. You're gonna see the big fancy lights on top of you, and then the anesthesiologist will say, count backwards or think of a fun place, and then you're out, okay? General anesthesia is provided. Then I come in, prep the skin, lots of cleaning, lots of preparation of the skin. Then I put the numbing medicine in, and then we start draping the surgical field. The implant goes in, we close everything up. Remember, you're gonna wake up with a drain. The incision will be closed with skin glue, and hopefully you're not gonna feel anything because I'm gonna put in enough numbing medicine that you're not gonna feel anything. You're gonna go to the recovery room, the PACU, and there's gonna be a bag of saline sitting on top of you. And this is just to help put pressure on the area, and we find that that also helps cut down on swelling and bleeding. We're gonna put an ice pack down there, we're gonna make sure you're comfortable, and then you're gonna gradually wake up from anesthesia. Eventually you'll get out of bed, we'll make sure you walk around, we're gonna have you go to the bathroom and make sure that you can urinate fine after surgery. And then once everything looks good, we go home, and that's when the healing process begins. So I would say one of the biggest things that guys go through about surgery, any surgery, is the anxiety leading up to surgery. What's gonna happen to me? I don't like being put under, and you get anxious. So what can you do? Certainly for the very anxious people, we can give you a sedative. But usually we try to do that as soon as you get in the building and we get your IVs going in. We're always here to help. And the other thing is one of the nice things about Coloplast is that they have go-to guys that you can call at any moment to talk to about your surgery, about before the surgery, after the surgery, whatever you need. These gentlemen are there to help you get you through your surgery. Certainly, if there's any questions before surgery, you can reach out to me or any of the physicians or physician assistants here at Advanced Urology. If there's a billing question, please direct it to the billing people. If you have generalized questions that you want to talk to with the Coloplast men's representatives, like I said, you're going to get those phone numbers and you can certainly reach out to them at any moment.